Tonight we've come to the beautiful east coast of Fife, to the town of St Andrews. It's famous for three things: golf, its world-renowned university, and of course it's where Kate met Wills. And more generally, we have under a year until the Scottish parliamentary elections. The SNP have been in power here for 18 years, but Labour had them in their sights, while all the parties here are working out how to handle the surge of reform. In the last few hours, the audience have been preparing their questions and opinions for our panel, and as a group, they reflect the general electoral picture across Scotland. And tonight they want to ask, why is Labour spending on defence but cutting back on welfare? And why, after 18 years in power with the SNP, the NHS here is still performing so poorly? Welcome to Question Time from St Andrews. Tonight's panel from the SNP is Scottish Government Cabinet Secretary for Social Justice, Shirley-Anne Somerville. She previously served as Education Secretary and is MSP for Dunfermline. Anna Sarwar has been leading Scottish Labour for over 4 years now. At last July's general election, his party overturned SNP Westminster dominance, although they remain the third largest party in the Scottish Parliament. Andrew Bowie is from the Conservatives and is Shadow Scottish Secretary. He's Westminster MP for West Aberdeenshire and Kincardine, and was previously a minister in Rishi Sunak's government. And in hot pursuit of the Conservatives and everyone else is Reform UK, represented tonight by Thomas Kerr. Until his defection in January, he was a Conservative councillor in Glasgow. And while Nigel Farage leads the party all over the UK, Thomas is now its spokesperson here. And the pro-Scottish independence journalist and broadcaster Lesley Riddoch has been observing and talking about Scotland for decades. She's now a columnist for the National newspaper and has a weekly podcast. Welcome to St Andrews, and welcome to our panellists here, welcome to our audience, very good to see you, and welcome, of course, to you at home. Sit back and watch the programme, joining the debate on social media, it's up to you. Right, let's take our first question, which is from Lorna Gibson.
Thanks. Why is the UK Labour government making drastic cuts in social welfare while increasing defence spending?
So, and that's going to come to you, but the plan, assuming it goes ahead, there's lots of question marks now, is that the welfare bill will save something like £5 billion by 2030. Equally, on the other hand, the government's pledging to spend £60 billion on defence next year. How has the Labour government got to a position where so many of its Labour MPs are rebelling and saying that you are penalising the poor and the vulnerable in order to save money?
Well, the first thing to say is that everyone can see that the world is clearly an unsafer place than it was even from a year ago, never mind from a decade or more ago. And therefore, the first duty of any government is to make sure we're protecting our citizens. And that's why the significant increase in defence spending is so important. And that increase in defence spending will also disproportionately benefit us here in Scotland, because so much of the expertise, for example, in our shipbuilding industry exists in Scotland. So that's billions of pounds of more investment and securing our shipbuilding industry here for decades to come. But on the important question of welfare, look, Labour MPs and ministers are doing their jobs, and that is trying to clear up the mess left by the Conservatives and to build a welfare system that is sustainable and is fair and prioritises work. And what we have to see in the coming hours and in the coming days is an agreement and movement that makes sure we meet the principles we all fundamentally agree on.
So
and
when
what
you
are
say
those principles?
movement and reach an agreement, you mean concessions on the part of the government?
There clearly has to be movement on the part of the government, so we have a bill that meets the principles that every Labour MP, whether they have signed the Reason Amendment or not, agree on. And what are those agreed principles? We all agree that we require welfare reform. We all agree we have to clear up the mess left by the Conservatives. We all agree that all those that can work should work. We all agree that those that need support into work should get the support they need. We all agree that those who can't work should get the support they need. And we also all agree that any change has to be a fair one. That's what they're working towards, and that's why I'm confident that we will get movement, we will get an agreement, and we will fix the mess left by the Conservatives and make sure we're prioritising work and giving support to those people that need it right across our country.
So when you say there's going to be movement and there will be concessions, I presume this means that the government is not going to be cutting £5 billion from the welfare bill. In fact, it's going to have to is going to have to give way and not be able to save that amount
Well, I
of
know
money.
discussions are ongoing. I imagine discussions are ongoing even as we are recording this programme right now. But I am confident that there will be movement, that there will be an agreement, and we will build a welfare system that works for everyone right across our country.
And since we've got you here, where do you think that movement will be?
So, look, there's some concerns being raised, in particular around PIP. It's important to stress, though, that PIP is a benefit that exists in England and Wales. It is not a benefit here in Scotland. Here in Scotland, we have the ADP, which the SNP announced just yesterday. They're reviewing the assessments and the criteria for, and they recognise that the sustainability of it is in question. It's interesting, though, that they think it's OK for the SNP to look at it, but they don't think it's OK for a UK Labour government to look at it. But also, other changes have to be looked at. But the most fundamental point here is 1 in 6 young Scots are economically inactive in Scotland, and that compares to it being 1 in 8 in the rest of the United Kingdom. That is not a proper and right place for us to be. How are we supporting those young people to get the support they need, but also to get the work they need so they can live fulfilling lives?
And when you refer to the ADP, of course, you're referring to the Adult Disability Payment, which is the kind of equivalent of PIP up here in Scotland. Shirley-Anne.
Well, let's be very clear. We are not making the changes up here that the Labour government are wanting to do. So what Anas is talking about is a review to make sure that the system is fit for purpose as it is just now, which is based on fairness, dignity and respect. And what you couldn't probably spot from the way Anas answered that is he actually supports the UK Labour government policies. And those are policies that by their... No, you've very clearly in the past said,
and so do you. That's why you're reviewing the criteria of ADP.
We're not. You can try and make this up as you go along, but you have 4 months.
Let her answer.
Talked about your support for Keir Starmer on this issue, and Labour's own policies, which Anas in the past has defended, has meant that 250,000 people will get put into poverty. 50,000 children. A Labour government pushing 50,000 children into poverty. And that's why we've taken the decision not to do this in Scotland, because let's be very clear, this has nothing to do with helping people into work, because adult disability payment, or PIP as it is in the rest of the UK, is a benefit that's there to ensure that the additional costs you have from being disabled or having a long-term condition are assisted with. That's what it's about. And actually, what the disabled people's organisations say is if you cut that, you're going to hamper people from getting to work. So the irony is we're going to have a Labour government cutting money from disabled people, and what will happen? They'll struggle more to get into work. The pressure will build on our NHS. The pressure will build on social care. This will not deliver £5 billion worth of savings.
Let's talk
even
about
if Starmer, with Anas's support, goes ahead with that.
Let's talk about your policies. So the welfare bill is increasing south of the border. It's also increasing here.
It is.
Are you happy to see that? Or are there reforms that you would like to make, and would you like to cut the welfare bill too?
Well, what we've said up in Scotland all along is you have to have a robust social security system, but it is an important safety net for people.
OK, but that's not answering the question. Would you like to see reforms and cuts to the size of the welfare bill here in Scotland?
Well, with respect to it is answering that question, because we have to have a system that supports people who need it. So I will not support cuts if it takes away from the vulnerable.
So you're happy to see the bill increase?
I am happy that we have a government that has the backs of disabled people, unlike Labour, and that we will not walk away from them up here in
Just to be clear, as the welfare bill is increasing in Scotland, you're happy with that?
Well, we know that we have responsibilities as a government to meet that budget, so I'm happy with the fact that we are supporting people, yes.
OK, that's a yes. All right. Man here in this dark blue shirt.
So I had a lot of friends, and I know a lot of people who voted for Labour at the last general election because they wanted change. They didn't want more of the Conservatives. They thought that by voting Labour, they'd have different policies. However, now they're coming to regret that decision because they wanted more support for those who are vulnerable in our society, and now Labour are penalising them more than anything. They wanted less money going towards defence and more money going towards the NHS, and Labour has not done that. So I don't know how any Labour MP can turn around at the next general election and say that a vote for them is a vote for change.
Well, it's not true, sir, to the specifics of what you said. There's £5.2 billion of additional money to go into Scotland's public services, a large chunk of that for the National Health Service. We've had the record increase in the living wage, a large largest increase in the living wage, a pay rise for over 200,000 Scots. We have the New Deal for working people that's finally ended
the gist of what you're saying, which is cutting welfare benefits,
would not be possible if we still had the Tories in power.
The gist of what you're saying, which is cutting welfare benefits and spending more on defence, that is incontrovertibly a Labour policy. Yes, Mania in the tartan cap.
Well, public spending on in social security is actually going up. Yeah, Fiona.
Okay, so reducing the rate at which it's going up. Yes, you're right. Yes, Mania in the tartan cap.
Well, you went on about the cuts and that, and about the reform and everything like that. But first of all, you took away the heating from the pensioners. Now you're taking away money from people that are disabled and not able to work. I do agree that if people are able to work, they should work. I've not got a problem with that. But you're taking away from the vulnerable before anybody else. I'm sure you could find money from millionaires and everything like that before you hit the people that are on welfare. That's my opinion.
And of course, as the Conservatives want the welfare cuts to go further.
Well, this is a really bad way of reforming the welfare system. Let's be absolutely clear.
Sure,
it's not going to deliver the savings.
Just so we're clear.
No, well, what we'd like to see is a properly thought-through plan from principle that will reduce the size of the welfare bill, get more people into work, and won't result in more taxes. This bill does not deliver this. And can I just say, it's astonishing, frankly, to be less than a year in to this new government, to see a Prime Minister and a Chancellor with so little authority. You've got over 120 MPs, including over 10 Scottish Labour MPs, willing to risk having the whip taken away from them, willing to embarrass the leader, openly speculating about leadership change. It took us 6 years to get to the stage that we were speculating openly about leadership changes in the Conservative government. So it's quite incredible, and it's because of the decisions that Labour have made up to this point, an inability to hold the party together, taking decisions out of expediency rather than principle, decisions on the economy that's seen growth halved, that's seen companies close up shop, that have seen the national insurance increase, the family farm tax, all of which has had a huge impact on economic growth, and making spending commitments, which on defence is necessary, but which you have got absolutely no clue of how you're going to make.
Let's talk about your
no lectures on economic competence and principles from the Conservative Party that destroyed our
Kerry Riddoch has made it clear she would support the government's reforms with certain caveats, such as no future tax rises. But it has also been clear that the Conservatives want to cut welfare and go further than Labour. So who would you like to not be getting money that's getting money at present?
Well, we need to see more people who are receiving benefit right now encouraged to get back into the workplace. I think we all acknowledge that the burgeoning size of the bill for welfare in this country is far too large. And for Shirley-Anne to suggest that it's not the case in Scotland is absurd. The welfare bill in Scotland is set to balloon to over £7 billion, which for a country of 5 million...
But I'm proud we support people. I'm proud we're there to support people.
We support
people.
And the way...
the 10,000 children that are homeless right now in your government's watch when you're in charge of housing policy? What about those children that are living in poverty? Can you support the children that are waiting on NHS waiting lists,
not able to get
the mental health treatment they need because of your disaster and stewardship of the NHS? And can you also deal with those communities that are blighted by crime and can't get a police officer because of your destruction of the criminal justice system? No, it's not.
Yes.
This is a government that's lost its way and is out of time, and that's why it'll be booted out of office next year.
Well, I think we're starting to realise why people get so fed up with politics, because we're only 10 minutes in and we're already punching each other to bits. Reform does back welfare reforms. Reform does back having the welfare reforms. We have to look at this properly. We do have a ballooning system and we do have a ballooning budget that has to be looked at. That is absolutely accurate. What we can't do is make it in the most vulnerable people, so people who are disabled. That's why Labour MPs are up in arms about this. It has to have proper consultation rather than being rushed through. Now, I grew up in poverty in the East End of Glasgow. I've seen firsthand what poverty is like. I don't just lecture people about it, I've seen it firsthand. And I know the best route out of poverty is through work. That's why Reform's whole process is to try and make sure the first tax cut we want to break is to bring the £20,000 tax-free allowance up to make sure that people are taking out a tax altogether. That helps people to be able to get money in their pocket, because if you want to fix welfare, you need to make sure that work pays. We need to incentivise people to get back into the workplace, and that's how you try and do it. You don't do it by just cutting. You need to have reforms, yes, but you need to encourage people back into work.
Well, let's talk about the reforms. I mean, there have been many who have been hugely sceptical about your tax plans and actually making the numbers work, as you know, not least the Institute for Fiscal Studies. But what I hear is you, Andrew, and you, Thomas, not you, Shirley-Anne, saying we need to reform. Clearly, the welfare budget is too big. Much less keen to say who's not going to get the money. So if you want to cut the welfare bill, who are you going to take the money from?
Well, the point is you have a huge bloated system since COVID, particularly of young people who are now being stuck because of mental health issues. So what you need to do is you need to invest properly into mental health to make sure that you tackle those issues and encourage those people back into work. That's the whole point, is trying to come up with incentives to get people back into the workplace. Now, in Scotland, we're in St Andrews, which is a fantastic university town. But what's happened over the past 25 years of devolution is we have a system that is now so builded around academia rather than skills. I'd much rather we focused into skills and apprenticeships to then be able to skill up young people.
Mental health and incentivising people
that's how you try and
to get into work. That's clearly going to cost money.
Yeah,
and you're talking about cutting costs.
No, I'm talking about welfare reforms. The point is this isn't about cuts, this is about reforming the system. That's where Labour's got in such a mess. This is not about trying to cut. The reason that this has became up is because it was in a spending review to cut rather than try to brand it as welfare reforms. It has to have a proper consultation properly with people who are struggling, and there has to be a real plan in place as to how this works long term.
We had Zia Youssef of your party come on this programme say welfare spending per capita will reduce significantly. So some people who are getting money now will not get money. That's clear.
Yeah.
And you want to cut the NHS's budget. You don't
well,
believe
hang on.
in
Let's do one thing at a time. Lesley.
Well, the Poverty Alliance say that, roughly speaking, spending on the welfare state has been fairly static, actually, at around 10% of GDP. So there's been ups and downs, but actually over the piece, it is not this sense that we're sitting with a kind of escalating time bomb of basically people who should be able to work and won't work. I don't know. There's been a 25% increase in the number of people committing suicide, dying of alcohol, of drugs, since COVID, since before COVID. So this is not like a snowflake generation. This is serious, serious mental health issues, which I think are also related to a dog-eat-dog adversarial society where people are in precarious renting situations, precarious jobs. Everything's precarious that for my generation was not. So you put that all together and you get, if you're unfortunate enough to be on universal credit, £100 a week. I'd like to see people managing on this. So we've got, for sure, this all needs to be looked at again. But in terms of the kind of benefits that Britain gives compared to other countries across Europe, we're still bumping along at the bottom. So this seems to me to be a completely unnecessary attack on people who have got no capacity to come back and argue about this. It's demeaning to end up being allocated points according to whether or not you can basically wash your undercarriage or not, because that's what it's coming down to. And I cannot believe that anybody who stood in any way as a socialist could possibly be looking at this as a viable solution to anything.
I think this highlights a real concern, Mr Sarwar, that the Labour Party in Scotland have. Instead of spending time highlighting 18 years of SNP failure, you're having to justify policies that are unpopular, that Keir Starmer and the UK Labour Party have been trying to implement. So you're now having to waste your time, spend time justifying the unjustifiable, when actually you and the Scottish Labour Party should be doing your duty and basically effecting a massive opposition to the SNP and highlighting all the policy areas that are letting Scotland down.
Okay, I'll let you come back to that in a minute.
Yeah. I'd like to say that there is a large number of people in Scotland who genuinely cannot work. You know, severely disabled people. A lot of these people can genuinely never work, and they should absolutely be given financial help and more if necessary, so that they are fully integrated in society and are able to live the best life that they possibly can. On the flip side, you do get a lot of people who are able to work who choose not to work. Now, I work in the Scottish Ambulance Service, and I meet many members of the public, and there are many, many people who are not working who are definitely able to work. And in many cases, the people who actually aren't working are earning more money than people who are knocking their pan in at work. I'd like to ask the SNP women, you've been in government all these years. Do you support that? Do you think that that's fair?
One thing I would say right at the start is if you're on universal credit, which is what you are normally on, The Joseph Rowntree Foundations and others have demonstrated that it doesn't even cover the bare essentials. So if we have people that are economically inactive, then yes, we should be encouraging them into work, we should be supporting them into work, we should be ensuring that the systems are there. That's exactly why we have the employability schemes that we have, particularly for parents and those that are disabled, to support and encourage people into work. But I think we need to be very, very careful about assuming that people that are on benefits are somehow on easy street, because as all the evidence has shown, they are not able to afford the bare essentials. And I think it is something that we have to look at as a society about where our values are. Because I won't apologise for being there to support disabled people or their carers, because let's not forget, when you cut disabled people's benefits, you cut their carers' benefits as well. And nor will I apologise, and I think we should be proud as a nation that we have a social security system that will help people in their time of need, whether it's low income, carers or the disabled people. I think that's a kind of compassionate society, because we don't know, any of us, when we will be in that situation ourselves. And we should have a society that's there to protect people, encourage them into work, absolutely. But let's never leave anyone behind on that. That's not the type of Scotland I want to see.
Alice, do you want to answer the question from the woman in the red jacket there? In a sense, you're slightly paraphrasing what John Curtis said, the poll guru said the worst thing that happened to Scottish Labour was that Keir Starmer got into power. What you're saying is, effectively, you're spending all your time defending his policies and not taking it on the SNP.
Look, I think the lady in the red jacket raises an important issue, but actually, if you look at the example of the Hamilton, Larkhall and Stonehouse by-election, where the SNP tried to portray it all as SNP versus Reform and disgracefully tried to push people into the arms of Nigel Farage, or you had the Reform Party doing their own dirty tactics in the campaign or trying to point at two governments. Ultimately, the overarching issue that meant that Scottish Labour won that by-election and ultimately beat the SNP and Reform is that people recognise that we do need a change of direction here in Scotland. So, of course, there'll be lots of discussions about the rights and wrongs of a UK Labour government, but the harsh reality is, in May next year, we have a stark choice. A third decade of John Swinney and the SNP in charge of our NHS, with 1 in 6 Scots on a waiting list, in charge of our schools, with them falling down the international league tables, in charge of the criminal justice system, and people can't get a police officer to come and help them when they need it, in charge of our transport system, and we can't even build 2 ferries under this SNP government, or a new direction with Scottish Labour. Keir Starmer's not standing to be First Minister next year. It's a straight choice between John Swinney and the SNP or me and Scottish Labour. And I'm confident in that choice. We will beat the SNP and take that new direction.
Now, you all want to come back on that, and you will get your chance a little bit further down the programme, I promise you, because we are going to be covering some of that in a couple of questions' time. Right, let's have a question first, though, from Jim Granger. Where are you sitting, Jim? Oh, there you go. Off you go.
With an increasing number of Scots now paying for private health care, is Scotland's NHS dying before our eyes?
So, Jim, what you're referring to is a comment by the chair of the BMA up here in Scotland. And when he said the NHS is dying before our very eyes, he was commenting on the fact that waiting lists are not going down, and increasingly people here are turning to private healthcare. Are you proud of the record, Shirley-Anne, of the NHS?
There'll be nobody in this room, whether it's on the panel or the audience, that's not been touched by the need for an NHS at some point, whether that's a GP or through our hospitals. And we know that there are still people that are waiting too long, and we know that there is more to do on that. And that's exactly why we're driving the improvement through that we are. That's why we have...
But when you talk about improvement, Shirley-Anne, so waiting lists have fallen in England, only a little bit, but they have fallen. They have increased in Scotland over the same period. The number of people waiting to start treatment for over 2 years is far higher than the total of England. And when it comes to cancer patients, a smaller proportion of cancer patients than ever before on record are being treated within 62 days referral in Scotland. SNP has been in power for 18 years. How do you defend that?
Well, we know there are challenges in our health service, and I accepted that
That's a heck of a challenge I've outlined just there.
Absolutely right at the start of that. But we are seeing improvement. So, for example, 97% of people, if they're in hospital, are discharged without any delays. We are seeing more operations happening this year than we were last year. We made a promise last year when John Swinney became First Minister to deliver 64,000 more appointments and procedures, and we didn't do that. We did over 100,000, and we're making that same type of commitment this year.
So what do you say to the cancer patients that are waiting?
Well, I know myself, even at this very time, my family and my friends have been touched by cancer. There won't be somebody in this room who is not. And I know that there is cold comfort to people when we talk about statistics and we talk about numbers. And that's why we do feel exceptionally very, very sorry for people that are waiting too long. That's a responsibility we have very, very deeply. But that's exactly why we have the cancer waiting time from when you're actually decision to treat to treatment is 3 days. 3 days. And that's an important reassurance that while I accept there is more to do, there is reassurance for people from that time of decision to treat to your first treatment. Your median wait is 3 days. And that's an important reassurance to get out. That's not taking away from any of the concern that people have, either in the audience or at home, about people who are waiting too long. But we're seeing that progress. You mentioned the 62 days. We're seeing progress, for example, in some of the work we're doing in our rapid treatment centres, rapid diagnostic centres, for example, in Lanarkshire, where that work will then be used where they are meeting those targets to ensure that we're doing that elsewhere in the country. So I accept the responsibility and the need for change, but that's exactly why we're investing in improvement.
Alice.
I agree there's a need for change, and the only way we get it is we boot this SNP government out of office next year. Let's look at the facts, because the facts are really important. 1 in 6 Scots on an NHS waiting list. That's over 800,000. In NHS Fife alone, that's 42,000 people waiting for a test or treatment. 5,300 of them in Fife alone have been waiting over a year. And in a rare moment of candour, you had the Public Health Minister, Jenny Minto, yesterday admitting that the SNP's failure on cancer waiting times means people are dying too early. That is completely and utterly unacceptable. And after 18 years, there's nobody else to blame other than the SNP, and that's why we need an urgent change. Right now in Scotland, 1 in 3 people are being forced to go private to pay for healthcare. And let's think about the examples of that. There are people who are remortgaging their homes, paying £16,000 to get a hip replacement. 40% of the hip and knee replacements that happen in our country, Scotland, are paid for privately because of the incompetence of the SNP. That is simply unforgivable, and that's why it's really powerful when Dr. Ian Kennedy of the BMA says that the NHS is dying before our eyes. Put bluntly, I don't believe the NHS will survive a third decade of John Swinney and the SNP.
And in the green and white top.
While I do agree with Anna's sentiment that we do need change from the SNP, it does feel like this is the same story as before with the UK. Right now, at the minute, I think Labour's having a crisis of identity and messaging, going from constant U-turns with winter fuel allowances to 5 pillars, messages and aims or whatnot. It just feels really hard to try and find out what the Labour Party's identity is and its agenda, rather than from we don't want to be like the current government, we just want to represent change, whereas change is this kind of ambiguous term that I feel like Labour don't really have the answer to at the minute.
Woman in the green and white dress there.
Your Labour chappie there. You just said
Anna.
that... Sorry.
No problem.
Couldn't quite catch the name, sorry.
No problem.
You said that most people waiting for the hip replacement are going private. Those private people are knocking the lists bigger because it's the same doctors, same surgeons doing the surgery, but because they're going private, they're knocking the lists bigger. You're not providing enough doctors. That's simple.
Woman at the very back. Yes.
Just be interested to know how you're measuring the improvements that you're seeing in NHS. If you're saying that the waiting lists are going down, is it not just because more people are going private? Just today I was getting a private surgery, having been failed by the NHS twice to be something to get recognised, and I was forced to go private. So I'm just wondering how you measure that and make sure you're not just...
If you don't mind, just tell us a little bit about that. So how long were you waiting that in the end you made that decision?
I first got this looked at nearly 10 years ago by an NHS specialist dermatologist who didn't think there was anything to be concerned about. I followed up again a year ago. I was told the same thing. And I'm not blaming these doctors who are very pushed for time. I work in healthcare myself. But then I went to see a private doctor because I'm fortunate to have the means to be able to pay for private health insurance. And as soon as they saw it, they immediately rushed me to have it removed. So, but I firmly believe that healthcare should be accessible to everyone and should be equal. But I've kind of been forced into this situation where I don't want to deny myself the health care that I can afford, but it shouldn't be at the expense of others.
Thomas, when it comes to paying for private insurance, and you're saying that you wish you hadn't had to do that, I hear what you're saying. I mean, your leader, Nigel Farage, is in favour of that in certain circumstances, isn't he? He said we need to, we could learn the lessons of the French system, which is partly state-funded and partly funded through private insurance.
As we've just heard, there's already an element in the British system where people are going private. Actually, too many people are going private. The fact that in places like the East End of Glasgow, you're now seeing adverts on television, on STV, to advertise private healthcare says a lot as to how far we have fallen as the NHS. So the NHS isn't working in its current system. It does have to be looked at and it has to be reformed. My position is very clear on it. You need to cut the amount of waste that does exist in the NHS. It is a huge bureaucracy, and just throwing money at it doesn't work. We've seen that time and time again. We have record funding in the NHS, but it's still not working for people on the ground.
But so do you support the idea of a mixed economy, like the French system, where in large part the private insurance system is paid for by employers rather than individuals? Which I suspect
as long as healthcare is free at the point of need for anyone who needs it, then I don't mind where someone gets their healthcare at all.
But it's not free if you're paying for it through insurance.
No, but if you can afford it and you want to pay it privately, then that's entirely up to a person individually. The point I'm making is that every single person in this audience and at home should have the access to free healthcare. That's always been Reform's position. This idea we're going to privatise the NHS is nonsense. And by the way, we heard this from the Labour Party. But Nigel has been very clear on this, and we've heard this, by the way, from the SNP and Labour when to the Conservatives we're going to privatise the NHS as well at one point. Everybody's going to privatise the NHS. It's not the case whatsoever. I am very much in favour of a system where if we can make sure we reform the system, whoever is given that healthcare, whoever can afford it, that's absolutely fine, but it has to be the principles of free at the point of need. But we need to get away from the idea that the NHS somehow just keeps getting better when we throw money at it. That's not the case at all. It has to be reformed properly, and we have to find a way of fixing it. The last thing I want to say is, here in Scotland, one of the big issues we're having is the number of doctors who are leaving. Because we have a higher tax system in Scotland, which has mean that people who are learning in our universities, like here in St Andrews, are then leaving to go down to England or to go travel abroad. I think we have to look at the tax system in Scotland to make sure it's fairer, to try and keep our homegrown talent here, to make sure the NHS works. I think that's just common sense to try and make sure we do that.
Lesley.
Right, Thomas, what happened to the 380 million quid a week we were going to get from Brexit? And what happened to Brexit stopping us being able to recruit? Coy there, because those of us who've been around a wee bit have had lots of big promises made about the health service. Somebody mentioned the French system or a different system. Try the Norwegian system. It's a proper health service, and it was funded on actually some of the profits from an oil fund. Oh, actually, we didn't get one in Scotland because, I'm sorry, we're part of a country that decided to elect somebody who just used that money to privatise utilities, creating an utterly unsustainable set of services in Britain, mostly in England, which basically we're still trying to fix. So, in an overall sense, we are stuck with the capacity to fund health that's a function of the English system. That's how the Barnett formula works.
Nonsense.
And the Health and Social Care Act of 2012 fundamentally privatised a whole lot of stuff in England. So we've got a bit of a mess going on with healthcare here. We've got a static life expectancy, which is shameful given the amount of wealth there is in this country. And overall, our health is not great. We need to be able to spend more money on it. Actually, Scotland would be able to spend more money if it was independent. And it's as clear as that.
Andrew. Andrew, you're laughing at that.
Well, I'm laughing at that because there's no evidential basis for that argument at all. This is coming from the...
Which bit of it?
The fact that Scotland would somehow magically be able to spend more on its health service if it was independent. This is from an organisation, a campaign group that can't even tell you what currency Scotland would be using post-independence, let alone how we would spend that currency on healthcare. Look, I have to say that the situation in the NHS in Scotland...
Anymore?
The situation... Well, we weren't a part of the euro anyway, so the argument's null and void, right? The situation in Scotland is dreadful. I was asked during the election if I thought Scotland had or was going to move towards a two-tier system for healthcare. Scotland already has a two-tier system for healthcare. I'm struck by the number of constituents that come into my surgeries on a weekly basis who are waiting months and sometimes years for a surgery. That has to change, and the SNP have been in control of the NHS in Scotland.
From? I mean, you already want to cut money from benefits. You have just, for example, your party, Keir Starmer, on Monday, committed 48 billion to defence spending, which was the first question we never really answered properly. Where are you going to find the money?
Well, hang on. Let's let Andrew answer first, and then I'll come to Anna.
The point on waiting lists is incredibly important and dominates the airwaves, rightfully so.
But you presumably, Andrew, hang on, you presumably are not proud of the Conservative record down in England when it comes to waiting lists in the NHS.
Well, look,
you're being very critical of what's happening here in Scotland. You can't be proud of that.
I'm very critical of what's happening in Scotland because I represent a Scottish constituency.
Well, what about
my constituents are affected by what is happening here in Scotland.
What about the record in England under the Conservative government when it comes to waiting lists?
We saw record spending on the National Health Service in England under the Conservatives. Yes, we saw waiting lists increase. That was partly as a result of COVID and partly as a result of the junior doctors' strike, which amazingly, after they went back to work, saw waiting lists come down. But my point was going to move on from waiting lists. We've got a huge problem in rural Scotland in recruiting general practitioners. We've got villages in Scotland now without a GP, a functioning GP practice. That has to be resolved and it has to be actioned upon. So all this debate about waiting lists, whilst right, we need to look wider because the problems of Scotland's NHS don't stop at waiting lists. They are far deeper than that.
OK, you both want to come back in, so briefly.
That's exactly why we are taking some of the action I've mentioned about rapid treatment centres. But can we just be clear? We have parties here that want to cut taxes in Scotland. Now, we do have a progressive tax system in Scotland. The majority of Scots pay less tax than the rest of the UK, but we do ask people to spend a little bit more if they can. For that, they have free tuition. I think there's a big difference with what happened, for example, in St Andrews. Because of that, we have free prescriptions. I think it's over £10 now for each prescription in the rest of the UK. It's free up here. So yes, we ask people to pay a little bit more, and for that you get other services that are not available in the rest of the UK. But the tax that we spend, the tax that we raise here in Scotland gives us more than £1 billion extra than they would normally have. So, if people like Labour and the Tories and Reform want to cut the taxes, what they're effectively saying is we will take at least £1 billion out of public services, and somehow they think that will help the NHS or help our education. So let's be very clear when people are promised you tax cuts or criticising the SNP for, yes, having a progressive system, what are they going to take away?
Amazing getting economic lectures from a party that spent £500 million for a ferry that was two ferries that were supposed to cost £97 million. I think Lesley and Shirley-Anne fundamentally missed the point about the National Health Service. We are spending more money than we've ever spent before in the National Health Service in Scotland. We have more staff than we've ever had before, and there have been over £3 billion of additional money going to Scotland's NHS from the consequences of decisions made by the UK Labour government. But performance is still getting poorer. And in reference to the lady in the green top and the young man that spoke earlier on, we have to fundamentally change the system. Because right now, we have an SNP government that is doing layer after layer of management and bureaucracy, where we have a situation with a population of 5.5 million people. We have 14 territorial boards, 6 specialist boards, 30 integrated joint boards, managers, chief executives, finance directors, when that money should be stripped back and it should be going to the nurses, the doctors and the treatments so we can clear the NHS backlogs and get our NHS fit for the future.
Let's take another question. Ivor Campbell, where are you sitting? Ivor Campbell. That's you. In the... Oh, there you are.
The attractive chap over here.
Yes, absolutely. As you describe yourself. Well done, sir.
Yes, self-described. How should serious voters respond to the shallow marketplace of ideas facing Scottish voters ahead of next year's Holyrood elections?
Well, shallow marketplace of ideas, Ivor. Yes. OK. Lesley, kick us off.
I don't actually disagree with you in many ways there. I mean, I was listening to what Anas was saying there about, you know, the health boards, for example. I mean, it's absolutely true. When we got devolution, there was a promise made that a Scottish Parliament would result in a more decentralised Scotland, and it didn't happen because the quangos that should have been bonfired weren't bonfired. We also have the least locally controlled country practically in the world, with the exception of North Korea. We have enormous councils. We're in Fife, one council. It used to have 87 councils. Now, What that means is, I'd like to know from Alice, for example, would anybody, and if we're talking about the paucity of big ideas, can we get to even a European average so that people have real control over real places? So St Andrews, for example, you know, famous across the world, doesn't have the power in this town to change the colour of its drain pipes. That's how we have not managed to decentralise Scotland. So yes, I'd like to hear that kind of discussion. I'd like to hear discussion about energy. We've got currently pylons all over the north of Scotland. My family come from there. I'm a huge supporter of green energy. But we currently have 113% wind renewables in our mix in Scotland. We can't currently export more to the south. So why are we ending up with this level of pylons? We have got a big subsea connector coming in. Are we simply here to produce cheap green energy to let England get to net zero without any hardware?
So if you think
I would like to know about these things.
OK, and if you think there's a paucity of ideas, or you're agreeing it's a shallow marketplace as you're putting it, Ivor, do you think none of the parties have got the answers then?
I don't think we're discussing these things. I mean, you know, I'm a big supporter of independence, and I'd like to see the SNP definitely lead on that, because where reform are picking up, I think, is that people are in despair. There is no aspiration, hope, bright light at the end of the tunnel. It needs to be fleshed out a lot, but people need to think that we're not sitting in a country that has been marketised to death, where there are better examples pretty much all around us. They need to think we're able to grasp some of those possibilities and discuss them.
Thomas, do you think reform is guilty of a shallow marketplace of ideas?
Well, no, I think we're the new kids on the block shaking up the system, which is why we're sitting at this table now. Look, I actually agree with the end of what Lesley said there, which is people are so in despair at the state of our politics. We took 20 minutes to start talking about Brexit and independence in this debate, and you wonder why Scottish politics seems to be stuck in some sort of Groundhog Day. That's why we're not focusing on the big issues that matter. We're not speaking about business. We're not speaking about taxation. We're not talking about education. We're not talking about the health service. We're not talking about big reforms. Instead, what we're actually doing is talking about past constitutional debates that have taken place and just tickering around the edges of what really has to happen to transform Scotland. Look, we have a record level of drug deaths in Scotland, and there is a bill in the Scottish Parliament right now called the Right to Recovery Bill, which is still sitting waiting to get passed because the SNP have not went ahead to push it. But they're happy to constantly... Well, it's not... But it doesn't... Well, you could take it on. The government could have took that bill on. The government could have took that bill on.
The government could have took that in, and he's running out of time.
And you could have took that bill on.
Care and actually was more interested.
Okay. I'm not here to defend the Conservatives. Look, what I am here to say is that you could have took that bill on and you didn't. Instead, you are debating independence and Brexit once again. And when you ask why people are so scurrant and fed up, that is why. And the choice facing Scotland next year, Annas likes to believe, is a new direction. It's not. Because fundamentally, Labour and the SNP, when you score away independence, are fundamentally the exact same party.
Well, listen, let's talk about reform. Hang on. You're here to talk about reform, or you're here to represent reform. Let's talk about reform. You say, you know, we're talking about, you know, Brexit and independence. We should talk about the big ideas. You listed education as one of them, for example. What is your policy on education?
So on education, we have to get back to localised education. We need to make sure...
What does that mean?
Well, right now in Scotland, we're talking about how we try and make sure we save funding. We have 32 directors of education across the country who are all basically told what to do by central government. What exactly are these people doing? That's the point.
So what do you want to happen?
Well, so what we need to do is we need to get back to talking about education properly. We need to get skills properly. And I already mentioned at the start about apprenticeships. Make sure we move away from academia and we try and focus more on working class kids getting the skills and the education that they need through apprenticeships. So there's plays that we're trying to do there. I can give you my personal opinion, Fiona, but what I can say
I'm wondering what reform's position.
But that's what I'm going to say. What I can say is that by the time all these guys finally put their manifestos out, there will be a manifesto from reform as well. And people can able to scrutinise exactly what it is that we're going to say when it comes to education, when it comes to health, when it comes to taxation.
So and
that will be something that is not going to surprise anybody in this audience, but it will be real fundamental changes to get this country moving.
Just to be clear, and in fairness, reform is a relatively new party, and your support is surging. I don't think there's any doubt about that here in Scotland and also across Great Britain. But when it comes, you're criticising other parties for not having serious policies and big ideas. At the moment, reform on a number of policies haven't got those either.
I literally just mentioned how we have to move away from academia to focus more on skills and apprenticeship.
Okay. Education obviously is a big subject, it's not just apprenticeship.
You asked for a specific policy, Fiona, and I've given you a policy. I can't sit here and give you an entire education policy. I'm happy to come here and do a big reform speech if that's what the BBC want me to do. But what I can do is give you specific individual policies where I can try and see that change.
And when we come,
can I finish, Lesley? When we come
to the election next year,
the same as every party on this panel, we will have a manifesto manifesto that the people of Scotland can scrutinise and can look at. I'm sure these guys will scrutinise it properly as well, and we can have a proper debate about how we try and transform
the best countries in the world, Finland, Estonia, they're top of the PISA charts, right? What have they got in common? They have very local control of everything, but they have kindergarten to the age of 6 and 7. And that lets kids have a really good start. In fact, in the world, 82% of countries send their kids to school at 6 and 7, not 4 and 5. We're practically unique, weirdly, with the Netherlands and the other countries that used to be part of the British Empire in deciding that 4 and 5 is okay. The best way to change education in Britain is to get with it and change that start in life to give kids really the best start, which is to let them be kids until 6 or 7. Would you do that?
Well, it's something we could look at in the manifesto. This is the point, Lesley. You have just put on a policy idea that we are happy to look at and to evaluate properly.
But why have you not
when we have a manifesto,
because this is out there.
I mean,
there's
to be fair,
research everywhere on all of this.
Hang on. Leslie, you made your point. Let him answer.
Reform is a new political party. We're happy to look at ideas that come forward. I've got a record as a councillor in Glasgow for the past 8 years where I have looked at stuff to do with early years and try to make sure that it's more outside based with the limited powers that we have in councils. If you look at my ward, there's a fantastic nursery that's outdoors in the park. So there's areas like that I have got a record on, but we're happy to look at that.
OK, let's hear a bit from our audience. Man in the blue shirt at the back.
Just continuing on that point, how it's maybe not the most interesting election coming up, can the panellists give us something really interesting and creative, give us some hope, give us some ideas that will change our society?
Interesting and creative. Right, I'm going to come back to that. Let me hear a bit more. Man in the black and white shirt there.
I think for me the biggest issue is that everyone's just kind of arguing. There's no actual ideas. What are you hoping to do? It's just, oh, we don't like the SNP, we don't like Labour. You're asking us to vote for you, but you don't really tell us what you want to do. You just tell us what you don't want everyone else to do. So coming from what the gentleman behind us said, can you just tell us what you're going to do without telling me everyone else what everyone else shouldn't do? Just tell you what you're going to do.
All right. Well, listen, let's go around. I'll come to you in a minute, Anna. So, Shirley-Anne, something interesting and creative, I think you said at the back there.
Well, I think this ties into a point that we were discussing earlier on in the programme about a compassionate society, about society should be there and we should be supporting each other through that. Now, we had that discussion about social security, but there are other aspects on that as well. And I think that is different within the SNP than it is elsewhere. We may have thought previously it used to be what Labour were like. I would suggest not so much now. But that, I think, it talks to the principles and the values that you should be looking for. You're quite right to look for and challenge politicians to have that. That's exactly the type of society we would then base the different types of policies on. So you have those values of a compassionate society. Lesley, I think it was Lesley talked about hope. Hope is an exceptionally important thing that we are lacking in as a society. And I won't make any apologies for talking about Brexit, because Brexit has had and has wiped out billions of pounds from our economy. So I think we should be pointing that out and recognising that if we're looking at something that is, yes, it's different now because other parties have walked away from it. I believe we should be in the European Union. I believe we made a fundamental mistake and we should actually look to join the European Union again.
All right, let me bring in other people. So, Andrew.
It's an independent country, and you're looking for a big idea, and an idea that actually now I think has got its time about compassionate and learning the lessons from the past when we were made big promises that have failed since Brexit. Then of course it's independence.
Andrew, so look, listen, this is a challenge. Come on, let's do it. Something interesting and creative.
Well, what's quite interesting, radical and creative, is actually the fact that I actually agree with Lesley on this. I do, which is possibly a first. I do think that we need to have a radical look at how we deliver education in Scotland. I think that looking to how the Nordic countries deliver that is something. We also have been quite radical in our proposal to let young people, leave school at an earlier stage if they want to get an apprenticeship or a skill and get ahead in life, if academia is not for them. And it does depress me that there is not more hope and optimism around in our political debate, specifically in Scotland, where we seem to keep getting dragged back to constitutional divisions of 10 years ago or 12 years ago, which I do genuinely believe were put to bed. We need to look forward and we need to build a better future for this country, I believe, within the United Kingdom. But yes, we need real devolution in Scotland. We need to see power devolved from Edinburgh, where it's been hoarded since 1999, to communities. And I think a radical shake-up of how we deliver education in Scotland is what this country, the people of this country, absolutely need.
Anas, I'm going to ask you to be relatively brief because I want to try and get one more question.
It's a really important question, and next year's election has to be about big fundamental choices. So we have to reform our NHS, reduce the bureaucracy, have greater use of technology and proper workforce planning to make it fit for the future. We have to change our education system where pupils and teachers can feel safe. So that means banning mobile phones in the classroom, teaching entrepreneurial skills and teaching digital skills in the classroom. You haven't done it, Shirley-Anne. You've done the opposite.
You can do that already.
That's what but you're not doing it just now. That's the exact point. But you're hiding behind head teachers. You didn't make a decision as a government yourself.
No, we're empowering them. We just asked us to empower people.
Further how we support business. We've got to reform our rate system to stop the rigging in favour of the online giants and reinvigorate the high streets instead. We've got to fix our planning system so we can attract investment here in Scotland.
Let's not do a whole long list.
And in energy, people want big ideas. And in energy, we've got to end the ideological block on new nuclear energy and get billions of pounds of investment here, thousands of jobs, and delivering energy security.
Let me come back to you. Did you hear something that satisfied you on the interesting creative front?
No.
No. OK. All right. Let's squeeze in one more question. It's an important one. Gary Craig.
By dropping the F-bomb, has Donald Trump played a masterstroke and actually reduced tensions between Iran and Israel?
Right, so what Donald Trump said, brace yourselves, he said, we basically have two countries that have been fighting so long, Iran and Israel, and so hard that they don't know what the, I'm going to bottle it, F they're doing. That's what he said. And it looked like the ceasefire wasn't going to happen. At the moment, the ceasefire is happening. So is that, in fact, a masterstroke? Andrew?
Look, I think we all have to acknowledge the action of the United States over the past week does seem to have led to a situation where we do have a ceasefire between Israel and Iran. We're very clear that Iran cannot be allowed to have a nuclear bomb. They have been a malign and destabilising influence in that region and around the world, a threat to British interests and the interests of our allies, and I think the action taken last week was proportionate and does seem to have the desired effect. However, I do genuinely believe we need to reinsert civil discourse into our public debate. I look at the degradation of the language that we use between each other and indeed in the public sphere when we're discussing politics and ideas in it, and it does depress me. So we need to, I think we all need to... You
don't like it when Donald Trump talks like that?
I don't think it's necessary, and I don't think that it's something that I would do, and I think we need to, across all of our democracies, relearn how to disagree agreeably, and that involves when we're discussing things as political adversaries and indeed when we're discussing things as a general public.
A masterstroke, Anas.
Look, I don't often say this, but actually I think Donald Trump in that moment actually spoke for a lot of frustration many people felt across the globe. Because the fact of the matter is, Iran shouldn't have a nuclear weapon. We don't want a regional war, and escalation doesn't help anybody. And we can't forget the people of Gaza in this moment either, where we have to see an end to the illegal occupation, an end to West Bank, the end to the starvation of the population of Gaza, and neither can we let Hamas off the hook. Their actions on October the 7th were actions of a terrorist organisation, and we do need the release of hostages. But
coming back to Iran specifically, that's the question. Do you think that Donald Trump's action has actually made us safer? I mean, there's somewhat conflicting accounts about whether or not it's actually got rid of the nuclear enrichment. I actually think what happens next is more important, and that is diplomacy and de-escalation. But the reason why I think it's important to highlight... One second.
I think the government agree with the action, because Keir Starmer's been unable to say whether or not he agrees with the action taken by America last week.
Keir Starmer's taking the right approach, which is to prioritise peace, diplomacy and de-escalation.
Do you agree or you disagree?
But I do want to make a broader point.
To disagree is a very principled position to hold, but we need to know whether or not the British government thinks it was the right thing or the wrong thing to do.
Look, I do want to make a broader point about the region and what's happening.
Question?
Well, I think Keir Starmer's taking the right approach, which is to prioritise peace, diplomacy and de-escalation, because there might be warmongering from some. I don't think that is the right approach.
Okay, let me bring in the rest of the panel here, otherwise I won't get a chance to do that, and we've not got that much time left. Shirley-Anne.
Well, I think what we've seen once again this week is exceptionally frightening for everyone, because what we've seen is further destabilisation in the Middle East and therefore the rest of the world. And my concern, yes, Trump may speak to frustration for himself and his government, but when you look at the longer term, I do fear that the lesson that Iran may have learned from this is the hardliners may learn that they need that bomb and they need it quicker. And I think that's always the fear when you actually see escalation, is actually what do people take from that, from the longer term, and the lessons they learn from that. So that's why it is very important to look at the aspects around peace and reconciliation. And I do think it is important, and we will, in this, I'll agree and have some consensus with Anas here, because the other aspect that has gone down the headlines and gone away from the front pages is what's happening in Gaza. Children are dying, people are dying, there's a humanitarian crisis, and I'm afraid we're now talking about whether it's Trump's ego or his language, and that's not where all our attention should be. We should never forget the children. Thomas.
I disagree with the idea that it's Trump's ego. I think one of the biggest threats to global stability is a nuclear Iran, and I think that what President Trump done was necessary and needed. Do I like some of the language that President Trump used? Look, I've got a 2-year-old son. Would I like the Prime Minister to be swearing like that? Probably not. But it is part of what Donald Trump is like. It's why the American people have voted for him twice, because they like that sort of bombasticness, and it has got results. As we sit here now, there is a ceasefire between Iran and Israel. So I think that, is it a masterstroke? Yes, because it's managed to work. And I think that that is just part of the diplomacy that comes with Donald Trump, and it's part of what the West just has to kind of deal with. It's not about his ego, it's about him doing what he genuinely thinks is right. And I think that the attack that he had to do in Iran was necessary.
Has it worked, Lesley?
No, I'm going to disagree with everybody here. I mean, what's happened yesterday is that the Iranian parliament decided to pull out of the nuclear watchdog. They are now voting, they probably have passed, leaving the non-proliferation treaty, which they were part of, which was one of the ways that sort of eyes were kept on what was going on nuclear-wise in Iran. Just by the by, Israel's not a signatory to the non-proliferation treaty and won't actually declare whether it has nuclear weapons or not. It's thought they have 80 warheads, but it's different rules when it comes to Israel. So I think a lot of people are looking and asking, why now with that raid that Donald Trump mounted? Because it's not at all clear that there was any imminent threat. And so this idea of managing to produce a ceasefire, that is quite good going when it's your own actions that have produced the jeopardy that put that whole region into turmoil. Just by the by, the BBC Persian service reported yesterday 3 people had been executed in a clampdown. I'm not saying the Iranians are a cool regime, they're not. And what's happened now is it's made it more difficult for the opposition within Iran to say anything. So was that a bit of a result? I don't think so.
Man in the blue sweater with the glasses.
I think when we look at what happened in the last couple of days and what we've spoken about tonight is about the frustration of inaction. And it might not have been done in the right way or at the right time, but I think it's refreshing to see something move forward, to see action rather than the typical back and forth that's seen with diplomacy and just talking about it and talking about it. The fact that action was taken has had a result, has made progress.
Man in the, you got a black jacket, I think, and blue shirt. Yeah.
Yeah, like, why is there so much little calling out of, Israel as such? Babies are starving, babies are being killed. And again, like she said, Israel doesn't allow IAEA inspectors in to look at their things. So there is total blackout of Israel. But we call out Iran, but we don't have the same stance for Israel. And we as a country are ignoring the plight of those little kids, basically. So,
well, certainly the situation with Israel and Gaza is something we discuss on this programme. And we have done it many times, and I'm sure we will do it again. But we are out of time to carry on with this question, I'm afraid. Thank you very much to the panel. Thank you to our audience here in St Andrews. Great to see you. Thank you to you, of course, at home for watching. This is our summer break now, so we will be back in September. But before we go, I just want to say that we will be also losing 2 very dear colleagues, our editor, Jerry Gay, and our producer, Charlotte Nesbitt, going off to pastures new, and we will miss them. But from Question Time, until after the summer, bye-bye.